All right, well, I will go ahead and kick us off. I just want to welcome everyone to our presentation tonight. My name is Jenna Johnson, and I am a graduate learning specialist with the Graduate Studies Support Center. Thank you all again for being here for our presentation sponsored by the SOHP IPE Advisory Committee. Our topic tonight is AI and Emerging Technologies in Healthcare Interprofessional Education. I do want to go just over a couple of things before I turn it on over. We are in a Zoom meeting, so please keep yourself muted unless you wish to ask a question or speak up. We do encourage comments and questions. You can use the Q&A feature, or you can also use the chat. I am recording our time together, and this video will be available on the Graduate Studies Support Center Skill Ups page within 24 hours. So now that all of that is out of the way, I'm going to hand it off to Professor Macomber.
Great. Welcome, everyone. Thanks for being here. I'm Linda Travis Macomber, professor with Health Informatics with National University. And thank you for your time. I'm hoping that we will enjoy the evening. Let me make sure. Here we go. So to kick us off with a few wise words from President Milliron, that really one of our kind of overarching objectives here is to use technology to make human moments precious. And hopefully that by the end of this webinar, that we will feel as though we're igniting that kind of impactful insights. And what I like to think of as kicking off the 21st century Renaissance age of artificial intelligence and AI. So game plan is that you'll be more empowered to discuss a lot of the advantages and hopefully avoid the pitfalls related to some of the AI-powered and emerging technologies in healthcare and education, and hopefully also want to explore further. I've created healthtechdiscovery.com, which is a kind of a multimedia resource for you, filled with career opportunities. And in addition to providing resources, let's hope that we'll all enjoy the journey together, and to think great thoughts and even go a step further to share them. So to get started, I found that, many of students and even ourselves, sometimes it's just fighting inertia to get started with any project. And I've found AI to be extremely helpful in this regard. And I wanted to share some examples. So how do we, keep that curiosity going to address these challenges? And how can AI and different technologies help? So in preparing for this presentation, it occurred to me that I might have been one of the few people that actually wanted to consult an assistant, and I recorded that. So I'm going to go ahead and play this. It's only about, maybe 2 to 3 minutes. But this is in preparing for the conversation here. And what we found that ultimately, it's not about AI versus humanity. Sometimes that can cause us to be kind of fearful. But I'd like to frame the discussion of really humanity together with AI being kind of better than either of us alone, that synergistic effect. And also to share one other insight that may not be that particularly obvious, but I hopefully will by the end of this webinar, that our challenge is actually a step beyond teaching each of us about the technology, but it's actually, as we progress, there's a role for all of us to actually be the ones who are teaching the tech. So kick back. Imagine yourself starting with any project or presentation and having an assistant to ask. Here it goes.
Through the material. So what exactly is the presentation about, and what's the angle you're taking? Are you focusing on a specific aspect of AI in healthcare or giving a more general overview?
Well, a combination of both. So I'm going to share some resources that I've put together for them. But what do you see as some of the, hottest topics in the area of AI and emerging technologies in healthcare today?
Wow, that's a big question, but I'm happy to answer it. In my view, there are several hot topics in AI and emerging technologies in healthcare. One is the use of AI for medical imaging, where algorithms can analyze images and identify patterns that humans might miss. Another is the use of natural language processing, NLP, to analyze patient records and provide insights that can improve diagnoses and treatments. And finally, there's the use of machine learning to predict the outcomes of treatments and make personalized recommendations for patients. Those are just a few examples, but there are so many others.
Well, let's dive into really that natural language perspective to be able to communicate with a computer, using my voice instead of typing. And how is that being used in healthcare? Can you give me some examples?
This is audio only by intention. Listen in.
Examples of how NLP is being used in healthcare. One example is in the area of radiology. Radiologists often have to read large numbers of medical images and make reports on their findings, which can be time-consuming and prone to human error. With NLP, algorithms can read the reports and identify key information, such as the type of imaging used, the findings, and any recommendations for further testing. This information can then be used to streamline the process and make it more efficient.
Okay. But what about really some of the more current use cases for ambient clinical intelligence for doctors and nurses and care professionals on the front lines? How can natural language help them working with computers?
There are several use cases for ambient clinical intelligence in healthcare. One example is virtual scribes, where the technology can listen in conversations between doctors and patients, transcribe the conversation, and automatically fill out electronic health records. This can help reduce the administrative burden on doctors and nurses, freeing up time for them to focus on patient care. Another example is computer-assisted documentation, where the technology can automatically generate notes and summaries based on conversations between care professionals and patients.
That ability to summarize information in an electronic health system can be quite helpful, I think. Can you share any examples of organizations, healthcare delivery systems that are using some of these, more emerging technologies today?
Examples of organizations that are using ambient clinical intelligence include the Mayo Clinic, the Cleveland Clinic, and Boston Children's Hospital. The Mayo Clinic, for example, is using virtual scribes and computer-assisted documentation to help doctors and nurses streamline their workflow. The Cleveland Clinic is using natural language processing to identify and triage urgent messages from patients, and Boston Children's Hospital is using the technology to generate notes and summaries for patient records. These are just a few examples of organizations that are using these emerging technologies to improve patient care.
That sounds great. I actually used to.
Okay, so hopefully you get the perspective there. What I was doing is actually speaking with the artificial intelligence instead of using some of the ChatGPT and other common language models. So what I found very helpful is the ability to actually, have these longer conversations and have that iterative perspective. So, clearly that the AI has progressed for healthcare far beyond, just that conversations that perhaps that you might have had, with Siri or other, Alexa devices. And so I'd like to think that we're at an inflection point in history because, for my entire career in history, for all of computer history, that we needed to learn the language of computers. But now that with this upcoming capabilities, that the computers are learning to speak our language. That's significant for the kind of, the computer systems for the rest of us to be able to speak with them in native languages. So question, I don't know if any of you have heard of the Turing test and know what that is, or if you do, maybe to, toss a thought into the chat. Maybe you've heard of it, but perhaps not quite sure what it is. Well, hopefully what you just experienced, and I'd like you to think of some great questions that you would like to ask, see if you can stump the AI as we progress with this session today. But, I think that it's important, as I've been working with these newer systems over really, I'd say the past 6 months and even the past 3 months, that you can see glimpses of this where I'm asking it questions and it's coming back in these more conversational perspectives. And so some say that we're embarking on the Turing test, which is basically if you're listening back as a judge, just sort of similar to the way that you were just doing, and listening to my voice and then listening to the computer voice. Clearly where it's at today, there's a little bit of a pause and it kind of thinks, but if you get to the point where it's somewhat indistinguishable, that you almost feel like the AI voice and the computer voice, you can't quite tell the difference. That's when we get to the point of kind of a more general intelligence. And wanted to just simply kind of look back a little bit as to sort of a little bit of foundation just for a couple of minutes, and then dive into some more demonstrations and some examples. So, but while I'm sharing, be thinking about kind of, see if you can stump the AI as we progress further, and we can actually try some live scenarios together. I think that sometimes when we reflect on the past, and particularly with all of the hype that AI has had over the past few months, I look back and I think, wow, why is it that I really like the way that some of these new systems are working? It kind of goes back to, actually realizing some of the founders of AI that I personally had met and had conversations with, including Marvin Minsky and a number of others. I was an ICU nurse at Boston Children's, working on my graduate degree, and also in downtown Boston, there was this Boston Computer Society. So I was probably the only one that went from the junior league meetings to this geeky meeting of the Computer Society. But that's where, like in the 80s that, it was the launch of the Macintosh in 1984. I mean, with Steve Jobs, it was the MIT leaders in AI that were a part of this group, and a lot of launching of incredible technologies back in that day that really sort of shaped my career to move from working in the ICU world into more informatics and information systems. But from that, actually, I realized that I had incredible opportunities to meet these founding fathers of artificial intelligence, and I think as some of you have known, that there are certain professors and people that speak very linearly and very much have very concrete reasoning and plans, and then much of the way these new AI models work is a little bit more this book Society of Mind. And it really fits with the whole interprofessional education perspective, because it really is putting the puzzle pieces together in new ways. And it's looking at both, our human intelligence, as well as what can the computer do? What can the human brain do? And ultimately asking questions, such as when should we use one versus the other? And that's starting to get a bit blurry at times as we look at the different challenges. So, but before we dive into some of the cool demonstrations, I thought I would do a little bit of thinking about thinking. Certainly, when it comes to, health professions, there's always a desire that we want people to do more critical thinking. Certainly, much of education, tends to be at that foundational level, where you see at the pyramid there that it's very learning oriented, based on recall and memorization types of activities. And those tend to be things that computers can do quite well. And so certainly computers are good at math when it comes to calculations, and they've become more advanced in algorithms. But what's been, I think, caught the people by storm is how some of these AI models, the algorithmic ones, as well as what are called the large language models like ChatGPT, the generative AI, can start really doing more creative things and help us with what I more the design thinking, the solutions thinking, the creative sides of things. And that's where I think a lot of the fun begins. And I hope you'll find that true as well. But certainly that their AI comes in so many different flavors. And I thought, briefly, if you want to know more in terms of my bio, I can share my LinkedIn profile. But I think one key piece of history in AI and decision support and algorithms that's sort of related to my career, kind of in parallel, is in the 80s, there was the large investment in more of the early electronic health record systems, really the patient care systems. And so working with what was called the composite healthcare system, I was actually the first, and at one point the only nurse working on that project, which has run for the past 36 years across the military. It's still in live production. But we built, even back then, much of the AI systems that you could call AI systems, because there were rules. We built in algorithms based on connecting lab results to medications, building in smarter pathways, and some early allergy checking, dose checking, and a variety of alerts and automatic notifications. We were just in the early days of moving towards smarter systems. Fast forward to today, kind of back to the future a little bit here. What's coming out in Time magazine in August is really sort of this sort of AI by the people, for the people, the unbelievable democratization capabilities, as these incredible capabilities are available on our phones, and phones are ubiquitously available. And so I found, in working with some students during office hours, and some of the students from India, from Africa, from the Philippines and other places, unbelievable abilities that we've been testing, that these systems translate into, really the languages of very nuanced perspectives, sharing some tremendous opportunity for global health literacy. And so I had the privilege of sharing some of that, and that was tweeted out, and kind of crazy on the right, just at the San Diego Convention Center last month. But certainly, what is it that this AI is really doing for us? In terms of, I think of it, sort of, it's as not artificial intelligence, but really that augmentation, that amplification of what we can do with it that we couldn't do otherwise. So think of all professions, using some of these tools And some of the buzzword that you hear is that it's not that AI will replace the jobs, but that those of us who are capable of using a lot of these power tools, will potentially replace those who are not. And what I always look at it is from the perspective of adding a double dose of humanity for each dose of technology. And that's really kind of stood from my ICU days to today. But there's a lot of synergistic potential. So think about it as in framing, as we look at some of these demonstrations, is how we can actually use these tools in practical ways. And what is it about this chat GPT, the generative, AI that has really hit us by a storm? I mean, let's take a look at some of the tech titans, for example, and the types of quotes that you hear. Artificial intelligence will have a profound impact, more profound impact than fire, electricity, the internet. Okay, this is obviously these are the CEOs of Google, CEO of Apple, that will affect every product and service, largest market cap company. Looking at it from the perspective that we're, I call it, we're at the beginning of this renaissance, and Jeff Bezos here said we're at the beginning of a golden age of AI. And so I think that, like what was science fiction, where we can really have in-depth conversations, verbally. And then, but I think it's often asking, just because we can do some of these things, the key question, and here's where I'll have kind of ask some questions for you as well, or what are the priorities? The question to think about, and let's open up into discussion after I kind of, provide a little more context. What are the most significant, most meaningful, most valuable? So as the CEO of Microsoft shares, I think he's on board, asking ourselves that question. Because there are lots of opportunities. I could share thousands of different use cases, and it would, keep us here for the next few years. But let's focus on some of the priorities, and that's, I think, something that we can do together. So we got the youngin on the crowd here. Here's the CEO of OpenAI, which is the company which has launched ChatGPT, Sam Altman. And I think he is really looking for those uses that they can talk about that really are doing the most good for society. And healthcare often comes up on the top of the list along with education. And so when you hear these sort of, I call them the tech titans speaking, and where there's, billions and billions of dollars invested here, what are impacts for healthcare and education? And then on the other side, it's like, let's just ask each other, ask graduates. This just came out yesterday, a survey of, graduates from college in 2023. And they said that over half say that the technology of AI makes them question how prepared they are for the workforce. That's a new college graduate that's suddenly saying there's so much happening on this AI front but they are eager to learn more on how that they can use these tools most effectively. And so that's what I've been working on. And I wanted to share, here's an example of working with an undergraduate on a project a couple of weeks ago, where their project is to create a website. It's a Health Informatics and Interprofessional course for undergrads, where nurses, public health, and health administration students take. And it's they really do focus on an area that's of most interest to them within the boundaries of health IT and digital health. And so it helps them. I think it motivates to be able to work on these individual projects, although it's a little more work for a professor than necessarily having the same. So once they choose their topic, I went into the generative AI to kind of help them along and give them a head start. So for example, one thing that I really like, this ability to create these summary tables. So I just said to provide a summary table of some digital health applications. This student was particularly interested in healthy pregnancies. And so it comes up with this following table, as you can see here. And with the new versions, it was accurate. I mean, it was not, quote unquote, hallucinating, making up things. It actually came up with some pretty helpful suggestions. Questions, thoughts? Let me see if I should check the chat here along the way. All right, so please feel free to dive in anywhere, stop me anywhere along the way. But on some initial
I have a
question, go ahead.
Yeah, so could you go back to the previous slide? Just real quick. So my question has to do with whether ChatGPT was able to provide citations for the Baby Center, My Pregnancy Today, or Ovia Pregnancy Tracker?
It can if you ask. It certainly GPT-4 does a better job with citations, and there are. I can show you. Let me just briefly go to the actual system. So here I'm live with GPT version 4. And let's just say, for example, I'm scrolling down to show all in addition to the others. And here I just typed in, okay, that's great for pregnancy, but how about for a new baby? And here comes you can see what it's coming up with.
Yeah,
now,
how do
are
I
these
know that it's not making it up though? So the references that they're using to acquire this information.
Right. Well, it's incredible the difference in the version that came out in the end of November, version 3.5, which is the free version, versus this is actually the paid version. And I also, with the paid version, that's $20 a month that I have. And in addition to GPT-4, there's this option, not to get into too much depth, but it's called Code Interpreter. What that does, and in addition to the plugins, they do connect with the internet and to give you more live perspectives. In addition to that, it's not perfect. By design, it absolutely is creating the next word by the way that it works. It's suggesting the next word. It is not sentient. It is absolutely not something that you would not want to double check. However, similar to the AI that I used on the intro, it's pretty darn good. So you can ask it for references. So and that's where it can fall down. It is definitely better with the new version, but it's not perfect. But it can come up with things that you might not have thought of. And I think that there's errors of commission versus errors of omission. And what I found really interesting is that, like, an example is a family member just newly diagnosed with cancer. And I went onto the AI system separately from Google. And it was the AI system came up with a larger number of perspectives that the Google Scholar search did not. And it's very interesting, without being a long-winded answer, and really the last step of anything that you work with is to double check it. So you can ask it for references. And then sometimes it will refuse. But whenever it refuses, I say to take an educated guess. Now it's gotten okay, so you can get it a sample. So, the Baby Center official site, is that accurate?
Mhm.
Yes, it is.
Mhm.
I just clicked on it.
Okay.
And so what I tell students to do is to just check their references and to click on them.
Mhm. Okay,
So,
thank you. That's pretty good.
yeah, I found actually with the new versions, in the past couple of months, I'd say it's about 90%, maybe even 95, depending on if the questions are tough or not. But other areas, for example, it makes a difference if you use the code interpreter and if you use plugins. So plugins, for example, it's kind of like a whole new AI store has opened. I used to speak on, did you know there's an app for that? And I'm putting together some presentations on, did you know there's an AI for that? So if you use some of these plugins, for example, there's one for Wolfram Alpha. Unbelievable difference. If you click into the Scholar AI, you click into connecting the core reasoning engine of ChatGPT with the plugins and other, what you see are becoming ubiquitous throughout many different applications in just kind of general life. Obviously, like, hey, when you watch a YouTube video, it comes up with a recommendation. That's an AI algorithm of what else you might like to watch. Netflix comes up with recommendation algorithms. Amazon comes up with recommendation algorithms. Those are the application programming interfaces connected in, and more. Here's an example. It's a whole new world. So, is it real or is it made up? Well, if I connect into the Kayak interface, and I've got an example here where I just created a whole trip and it was all very real. And you could just speak in English. I like using that on my Mini because I can just click on the microphone and I can carry it around with me. It works well on the phone as well. But kind of a balance of things. But what I found, what's interesting with students is that just starting to use it a little bit for search, for getting started, coming up with some ideas. And that they become less fearful. And I hope that all of you will be hopefully, less fearful, wanting to give it a try, seeing what it can do. But here's some examples, certainly, of some demonstrations I've done in class in that, they feel kind of, excited about it. Opening ideas to kind of some amazing healthcare innovation possibilities. So, what are the things you can do? I've shared some of this before, some of you may have seen, but say the top 3 are really getting started. What we can do is search, and I could do a whole session on the difference between Google Bard versus Claude versus different versions of ChatGPT. Most exciting, I've got the beta version, and it's available for free as well. I had to get on I've been a beta user for Google since I guess, oh my goodness, I used to work at Google with the early days of Google Health back in 2009 or so. So I've always kind of been on their tester list to please. So they asked me to test stuff out. But it's now more generally available. And so search is pretty amazing. So other things that it's good at is summarizing. So for example, with student permission, with them said, hey, and without any names, not, being careful never to put in student names, but just taking a blob of their text and saying, for students that are creating a web project, gosh, too many words. And I for people who know me, I can sometimes need more words to say things. And so you can take a text and then ask for those bullet point summaries. and it also works multimedia. So I actually use it to create the different videos, and so that summarization capability is incredible. For setting the stage for different scripts and simulations. And this is something, Dr. McNeil looking at the potential for different scenarios and setting the stage. It comes up with some really wonderful suggestions. Taking a look at the Socratic method, it just as though as that initial discussion when getting started, that there was that ability to kind of go back and forth like a tutor. And so I've done some iteration with different students that they found that very helpful. So coming up with kind of that iterative discussion. But ultimately, just as I was sharing, before you click to share it, that's the point where you need to check and fact check things. So I'm not going to go into the details. If anyone is interested, I call it sort of the Sweet 16 of proficiencies on really becoming kind of more of a power user of these tools, but not needing to create them. You don't need to be an engineer, but simply using these tools in daily life. And from a career perspective, I sort of see there kind of, three core levels. One is, I need to learn AI, but if you need to learn it to actually, programming, and yes, you can just speak to it in English. And I've been creating Python programs without having to learn the details of coding. I used to work as a coder, but haven't done that for a number of years, but very interesting. Just you put out the designs of what you want, and the code is automatically generated, just like the words are automatically generated when you're asking for it. But certainly the ability to kind of bring this into your own life and everything that you're doing, and just amplify and doing a better job, I think is where the sweet spot for most people will be. Kind of that life skills. Adopting the technology as more of a personal assistant. And then they'll be similar to like clinical informatics specialist roles across healthcare with various electronic health systems over, for me, the past nearly 40 years. It's a very similar role to help others then in using that. But I'm guessing you all do Google searches, right?
Linda, can I ask you a question?
Sure. Go ahead.
Hi, this is Alice. My question is, a lot of the people who are on here are students in nursing leadership and healthcare administration. How can this directly help them in their future jobs, or even in their dissertations that they're trying to develop? How can this artificial intelligence help them to get really good information for to work in a high reliability organization, or to decrease safety infractions, things like that? How can this help directly?
Well, let's take a look at some examples. One is, in addition to a traditional Google search that you would do as a part of your job, that by turning on the generative AI, and you can go to Google Labs to do that today, but you pretty well, Microsoft has already announced that these generative AI tools are being built into Word, they're being built into Excel, they're being built into the entire Microsoft suite. And so, many hospitals and healthcare organizations have these, but certainly, you can sign up for an OpenAI account for free, and be able to just simply, have some basic familiarity with it. I encourage people to, even if it's just writing a poem, and just, kind of getting comfortable with it. But it's similar when you're first starting to think of it being like a different kind of Google search. And so from the perspective of evidence, I think as long as you check it. So for example, let's go to my Google search. And when I put in, share some what thing like hot topics in healthcare quality improvement. All right, so you've got the traditional Google, where you may get a whole lot of things. You can look at all of these different things that come up, or maybe use Google Scholar or the library. But in addition to that, I think the relevance of being able to use the AI. Here's an example where it summarizes and synthesizes some of those articles for you and gives you that initial good start. So here's some topics related to healthcare quality improvement. And then you can iterate with it, such as ask for a follow-up. So if you're interested, like, Kaiser Healthcare Foundation, 45% of adults say that it's difficult to afford healthcare. So, you can dive into any of these and you can sort of see what sort of like the future of Google is going to look like over on the right-hand side here. So this is available for free if anyone wants to sign up for that. In terms of, asking follow-up questions with it, which you hadn't really been able to do. And that's the part where you can dive deeper into research of any particular topic. So I would say starting there, if you don't want to, pay the $20 a month, then there's a free version of the software that is available. You can go to a new chat. It's just an open box that you can type in anything. So what would be an example of something that you think would be helpful to ask?
So Linda, recently I had to produce an editorial sort of like overnight on simulation. And so I went to the free version of ChatGPT and asked for some references and some ideas. And in about 2 or 3 minutes, it gave me pretty much of what I could use in the editorial.
Right. It seems like, we could do even just an example would be, perhaps a graduate project might be to, draft an introduction or a grant proposal for AI in healthcare and, let's just say, interprofessional education. I don't have the mic hooked on for this one, but usually I speak to it versus type. So you can see it can come up with some draft words. Now, is it going to be what you want? Is it going to be something that would be funded? Likely not, but can it help that initial thought process of getting started? I think it's starting. So maybe there's some grant funding out there for AI in healthcare. As we aspire to address ever increasing demands, sometimes just some additional words to help, as an example. Anyone else want to give it a test drive? I'll check the chat. So we can try driving
in the
chat
example
GPT.
that you just provided, I also asked it for references. And so it gave me about 12, and then it gave me the caveat that I should look at PubMed or something else for more scientific research studies. It did tell me to go do that.
Yeah. And so you can please And sometimes if it doesn't do it, I do say to, take an educated guess. Sometimes you need to kind of coach it along a little. Other times, sometimes you say in the style of is kind of another sort of a keyword that's kind of interesting. Sometimes you need to give it a little help, like the word continue, for example. So what I found is that, some might be incorrect, but you can certainly, as long as you check them, it can be quite helpful. And now other tools include Google has Bard, and there's another one called Claude. So that there's really competing tools that are available, and many of them they're just evolving, so they're different. Let me go ahead back to the slides. But you can. What I like to do, and here's this slide shows it, is I add to look up the Google search right next to what ChatGPT comes up with. So see on the right-hand side of the screen there that there's the ChatGPT version without having to go to ChatGPT. So I've connected the dots. So then I can choose, do I want to look at Google or do I want to look at the summary? And sometimes I like looking at both. And I think for anything that's particularly helpful. And realize it says, hey, this AI is experimental and quality may vary. So they're sort of checking themselves from a legal perspective. But when it comes to creating an abstract, with being able to copy and paste in some of your own text, and just ask for that to summarize it. I screened quite a few videos for the Discovery Lab. So sometimes I'm not sure if I want to watch the whole thing. I happen to open, some of them, but right next to it, I can set it up and configure it to be able to just look up that sample. So here was the Google I/O, which is the kind of the big, what's all the cool stuff that Google has. And I just wanted an executive summary of it that was right from the transcript. So what the AI does is it copies the transcript of a video, and then it comes up with a summary for me. So instead of having it be biased by somebody else, I can go to the source and ask for that summary. Other thing, really, Alice, Myers, Dr. Myers, related to your question, other things that might be helpful on your students that are doing some statistical analysis. So, for example, I downloaded a file from the CDC, just kind of a standard, kind of a spreadsheet on I was looking at if there were excess deaths perhaps with COVID, and some initial analysis, and just thought I'll just see what the system could do. So I have the ability with the new version to connect a file. So I can upload a file of data, such as on graduates. And then I just asked it the question, please provide an executive summary and an analysis of this data. And I just left it up to the AI to find something that was significant. And it created this beautiful graph. And, very quickly, it created the Python code and it showed me the Python code that connected with the data and then created these wonderful data science analytic videos. Also, I took a generic grad rate analysis that was out on the web from different universities and say, just import that file, like a spreadsheet type file, and then just asked it to do some analysis. And it wrote this up in English, So it's like, hey, what insights did you find? And I thought that was really quite interesting. It also, I connected to, Wolfram Alpha statistical package that's quite well known and reliable. Again, Dr. Myers, for what would be reliable? If you connect this to some of these programs, they're very reliable and scholarly. And the other thing that I've been doing, and it's been helpful as I create some review. So if I add some comments, and then I use the AI system to help maybe synthesize and summarize some points, but I don't want to take credit for that in my student feedback. And so I want to differentiate what I wrote versus what the AI wrote, which is always a big challenge, right? Because it kind of gets sort of blended. You know, sometimes after all these years, I can't necessarily, I don't know where I know things from because it's like, that rich collective wisdom of assimilation tends to happen. And that's really what the AI has done, because it takes what's out there on the internet. So, but what I can do now is I can share the URL of my conversation with the AI. So it is very clear that this is what the AI did. And then I share in the feedback link to my students. And so I provide, hey, I think this is great that you've written this. I think it just needs a good executive summary. Here's an example and some key points, particularly for website writing. So I have several classes where students create blogs as well as websites. So the fun is just beginning for the entrepreneurs out there, and also those working in healthcare that might want to dive in more. So you can connect all these different applications together. For example, a trip to Chicago, and it actually will. It's getting to the point where it'll book the reservations and it'll do a lot of the work for you. On an academic front, I realized we were kind of running out of time. I wanted to pop in some more questions and open this up in general. But there's a lot of shifting. I think that there's this very, data-centric, got to have the evidence, logical empiricism. But that doesn't mean that I call it a patchwork rationalism. And that's, not to be too academic, but that really is the society of mind, is that the rich collective wisdom of all of us, that crowdsourcing might be better than any one source from any of us. So that's what really, if you look at the two different flavors of a lot of the AI tech, one is absolutely, there are several hundred FDA approved algorithms, and Mayo Clinic is starting a whole new companies launching the new algorithms. And if I'm doing a lung scan and the AI is coming up with a 99% reliability in detecting cancer earlier than a human, I'm going to want the AI. However, that's very different than this more generative perspective that we've been sharing that requires sort of that safety check. I'm running out of time, but I think that really ultimately we've got to move more at the speed of tech, which is a bit faster than the tectonic plate sometimes of large organizations. And I will not read this poem to you, but I'll just basically share this, that I wrote this with the AI. Now, I am not a poet. But it was kind of fun. Can we add more fun to life? So this one, I'll maybe just kind of read the one verse, and you can kind of scan through that, and then we'll kind of open it up to more questions. But yeah, the dance, connecting the old with the new, a testament to what collaborative hearts can do in this grand orchestra of life, where tech and humanity blend, composing an unfinished symphony that knows no end. Now, it's not necessarily the best, but I couldn't have done that without the AI. And so I'd like to basically, open up, certainly my LinkedIn profile, and I ran out of time, but I did want to let you know that there is an incredible world of references. I've done references in my own I basically created 16 blogs. And so on anything related to health tech, you can go to healthtechdiscovery.com. the About page, you can learn about me. The AI tab really has a full set of not just in current articles, but where you can find more information. So if you want to dive more into personal health technologies versus, you want to know more about that nuance and the virtual connections, you can dive into clinic, and these sort of progress. And I'll summarize here from the tech to support each of us and our families and loved ones with patient health portals and all of the current perspectives versus the clinical visits versus all of the cool stuff happening in hospitals, including digital health for acute care at home. There's several hundred videos, lots of links, lots of professional organizations, from acute care to population health to connecting the dots of care. So with all of that, I wanted to open it up to some additional thoughts and questions, and then I can stay on after the session as well if anyone else wants to test out some of the perspectives. So opening it up for thoughts on...
Yeah, we definitely want to have some time for Q&A here, so.
All right, fire away.
Dr. Myers, did you have anything specifically that you had wanted to ask?
I did ask, and Linda did answer that. I wanted to know the relationship that our students could use with AI with being future leaders, and some are leaders now and getting their advanced degrees in leadership. But how can it help us with patient safety and with, with our highly reliable organization structure that we need now? And I believe that Linda did a good job of answering that.
Perfect. Okay. Well, I just double checked the Q&A in the chat and I don't see any questions. I thought
Well,
we had some, but I don't
while
see
we're
any in the chat.
while we're waiting for other questions, please feel free to chime in. But with the last few minutes, I did want to say a little bit more about what you can find under these tabs. So, it's so challenging in this world of digital health because every day there are new announcements happening. So what I tend to do is I have a couple thousand people that are leaders in the field that I'm connected with on LinkedIn, and I, encourage, different, and being able to see them in my network feed. I really love the different perspectives that come through. So when I find something really helpful, then I save it and I basically categorize it into one of these 16 blogs. So it's a very different, instead of just, reposting on one blog and then it's all kind of together, that's something that is related to cybersecurity and healthcare, that is, sort of hot news. I'll put it there, versus some additional places. And if I'm not sure, here kind of what's next. So just in the past week, for example, what is big tech doing? Epic is connecting with the use of ChatGPT in practice. So you might have a message from your doctor that has been drafted by the AI and then validated by a physician. This Amazon just came out with Scribes. Google is announcing their new search here. And so all of this is, what's happening with Amazon Clinic. For example, the news of the day that is most specific, the top trends, and different reports from all the consulting firms, you name it. But there are, it's really a multimedia library of resources. So that's kind of instead of just sharing a list of articles, These are current videos, current webinars, websites that have from everything that Epic Research is doing, and that would be, I think, one other area. Dr. Myers, in terms of what students might be particularly interested in, because certainly being able to connect in to some of the latest on, all of that is available through now getting all of those insights out of the electronic health record systems, and tremendous amount of research that is being done and tapping those in new ways. So I think, learning more about Epic, there are a number of for people who aren't currently working in the field and want to see some video demonstrations and learn more about it. Digital health across the globe for the public health students. There's just a lot here, and let me know if you want to know more about it, but it's healthtechdiscovery.com.
Well, Linda, thank you very much. Unfortunately, we are out of time, but this was a great presentation. I think you gave us a terrific overview, and you did help, I think, a lot of students who are looking at how they can use AI, and a lot of faculty who are looking at it. So I thank you very much. This was terrific.
Well, hopefully you're not overwhelmed and instead inspired. It can be overwhelming, and it can be kind of scary. A couple of books, I do enjoy this one. And if you're feeling a little bit scared, this one, Scary Smart,
Well,
is kind of a favorite one. And, please feel free to reach out to me, Linda Macomber, lmacomber@nu.edu. I'll put that in the chat.
Thank you so much. And thank you everyone for attending. Really appreciate it. And I hope you learned a lot.